Hello there, and welcome to today's presentation, stroke discussion. So, in today's discussion, you're going to look at how to nurse a patient with severe malaria. Guys, welcome to Keep Calm and Nurse on YouTube channel with me, Cindy. I'm a BSN and RN, and on this channel, we like to share information related to your health because your health matters. So, as you may know, it is that time of the year when we have a lot of malaria cases, and usually in the hospitals we have increased cases of severe malaria. So I thought it is very important. It could be helpful if we are revised on how we can take care of a patient with severe malaria. So let's get started. So the aims for the nursing care of a patient with severe malaria is that we need to provide acute and immediate care to the patient and the family members, because usually these patients are unconscious, or they may be convulsing, or they may have behavioral changes. um, Therefore, it is important for us nurses to also consider their relatives, their parents who have brought these patients to the hospital, because they may be anxious. So we also want to involve them in the patient care so that they are not anxious. Then the second is that we want to provide a patent airway and prevent complications such as hypoglycemia, and we also want to manage convulsions and prevent any injuries which can come about due to patient convulsing. So there are a lot of problems which a patient with severe malaria can have, and in this presentation we are just going to look at the five problems that we've identified. So the first problem we've identified is that the patient will present with altered thermoregulation, which can easily be said to be fever. So the nursing diagnosis is that fever or thermoregulation would come about due to or related to the infection and inflammatory process which is taking place in a patient's body, which could be evidenced by a patient having a body temperature of 38 and above. And our objective would be that we want to reduce fever in the shortest period as possible and keep the body temperature within the normal range throughout hospitalization. Now, our nursing interventions include removing extra linen and clothing and opening nearby windows. This is done to reduce fever through evaporation. Then we also would tepid sponge the patient using lukewarm water to allow heat loss. And we also give prescribed antibiotics such as paracetamol. These will reduce fever and reduce pain to the patient. Then we're also going to monitor temperature hourly. So hourly monitoring of vital signs is going to be done on this patient to detect any deviation from normal and to assess if the patient's fever is reducing or not, so that we can do other interventions if what we have done has failed. So in our evaluation is that patient body temperature has reduced following the nursing interventions, which is which is evidenced by body temperature, a patient having a body temperature of 38 to 37. And the next problem is altered level of consciousness. So the nursing diagnosis is that altered level of consciousness related to altered microcirculation, accumulation of toxins and cytokines, and parasites in the brain blood vessels, which is evidenced by patient being unresponsive or convulsing. So because there is accumulation of toxins and cytokines plus parasites in the blood vessels of this patient, the patient will present with altered level of consciousness, especially if those things are in the brain. So now our objective is that we want to assess the level of consciousness, we want to abort any convulsions present and prevent any injuries which can come about to a patient convulsing. And the nursing interventions are as follows. Use the Glasgow Coma Scale to assess the level of consciousness. So a Glasgow Coma Scale is a tool which is designed to assess the level of consciousness for a patient. It's a very useful tool because it helps health workers to know if the patient is responding to treatment or not, if the patient is becoming awake or not. Then the second point is that we are going to observe any convulsions. If the patient is convulsing, we want to note the type of convulsions, the duration of these convulsions, and we want to record them on the fit chart. We are doing this because we also want to rule out status epilepticus, and also it can help the medical doctors to see and assess how long these convulsions are taking and if these convulsions are responding to anticonvulsants that we are giving. Then also you're going to administer prescribed anticonvulsants such as diazepam or phenobarbital according to what has been ordered. Then we are going to record on the fit chart. Then also we are going to nurse this patient in an acute bay or high dependent unit or in intensive care unit. So it is very important to note that a patient with severe malaria has to be nursed in these areas, the ICU, high dependent unit. If those areas are not available, the patient should be nursed in acute bay. All this is done to monitor the patient closely. Then also monitoring of vital signs is going to be done hourly to detect any deviation from normal. We are going to assess if the patient's temperature are within the normal ranges or if there is need for any intervention. Then the last point here is saying nurse the patient in a railed bed. So because the patient is convulsing, they are at risk of falling. So we want to prevent that. We are going to prevent that by nursing this patient on a railed bed to prevent the patient from falling. So in our evaluation is that the patient is responding to treatment and interventions, which is evidenced by a patient having a Glasgow Coma Scale of 15/15, and the patient is not fitting, and the patient has been closely monitored. So the third problem we identified is the altered feeding patterns. So why would a patient with severe malaria present with altered feeding patterns? This is because the patient is unconscious. The patient is having behavioral changes. So how can they feed? So the nursing diagnosis is that altered feeding patterns related to patient being unable to feed and swallow the food and being unconscious. So our objective is that we want to prevent dehydration, provide energy, and to feed the patient and prevent hypoglycemia. So under our interventions, first of all, we are going to monitor random blood sugar levels. We are going to monitor this using a glucometer. So you check the blood glucose levels, and then administer the prescribed fluids such as half-strength diluents or if it's 5% dextrose, depending on what has been ordered. So you're going to administer these fluids. Then these fluids should be connected to an IV infusion pump. So an IV infusion pump will help prevent fluid overload. So when the fluid is connected to infusion pump, also calculate the rate of drop per minute or per hour. So this is done to prevent fluid overload. Then also monitor strict inputs and outputs of urine. We are going to monitor strict inputs and outputs of urine. This will be done through the insertion of the urinary catheter. So because we want to monitor strict outputs, this patient, we are going to insert a urinary catheter for monitoring of urine output. And because this patient is not feeding, we are going to insert a nasogastric tube. We are going to insert a nasogastric tube for feeding the patient. And when we feed the patient, we're supposed to record these feeds on a feed chart. So the feed chart consists of the amount of feeds that the patient has been fed, the type of feed the patient has been given, and if the patient has vomited or not. So this will help us in monitoring strict inputs and outputs of what we are giving the patient. And in our evaluation, we are going to see that the patient's random blood sugar has been maintained within the normal range and the nutritional status of this patient has been maintained. So if you are a student and you are learning how to write a nursing care plan, you can pause this video and close the C and read what is there so that you understand more clearly, because I'm quite fast because of time. Then the third problem is that the patient will present with difficulties in breathing or dyspnea. So why would the patient present with such? Our nursing diagnosis is that difficulties in breathing related to respiratory involvement, and anemia evidenced by labored breathing with low oxygen saturation levels less than 93%. So our objectives would be that we want to promote a patent airway and increase oxygen saturation levels. Now, why would the patient have difficulties in breathing? One is that we know that anemia is one of the complications of severe malaria. So if a patient has got anemia, their hemoglobin levels are low, it means they'll have difficulties in transportation of oxygen to the tissues. So this is where difficulties in breathing may also come from. So during our interventions, we have to make sure that we are correcting that. So in our interventions, first we are going to monitor oxygen saturation levels using a pulse oximeter. So this patient should be also connected to a cardiac monitor. If the cardiac monitor isn't around, it's not available, we can monitor SpO2 levels using a pulse oximeter. This is to assess the levels of oxygen. Then we also commence the patient on humidified oxygen. Why we are doing so is we want to promote oxygen saturation levels, we want to promote tissue perfusion for the patient. Then we can also elevate the head part of the bed. This is done to promote full lung expansion. We understand that when the lungs are fully expanding, there is increase of oxygen moving into the lungs, which can help with the oxygen saturation. Then we also administer blood transfusion in terms of anemia, which will help increase hemoglobin levels. And if we increase hemoglobin levels, we are also increasing oxygen saturation levels for the patient. And in our evaluation, we found that our patient has been relieved from dyspnea and labored breathing. So this can be evidenced by a patient having oxygen saturations above 93%. So the last problem that we identified is self-care deficit. So this is one of the general problems that the patient is going to present with, because the patient is unconscious. The patient is not aware of what is happening. So the self-care deficit is related to the disease process and the patient being unconscious. And now our objective is to assist the patient with the activities of daily living and prevent formation of pressure sores, because this patient is unconscious. They're just laying on the bed, they're not making movement, which makes them prone to pressure sore pressure sores. So in our interventions, we are going to provide a bed bath and oral care for the patient. So we are going to bath the patient because they can't bath themselves. We are going to provide oral hygiene for them. All this is done to promote hygiene and blood circulation for the patient. Then also it is important that we provide a 2-hourly trainings. So we are going to be training the patients 2-hourly. This is to relieve pressure on pressure points. This prevents the formation of pressure sores. Then we're also going to provide care like nail care, hair care. All this is done to promote hygiene for the patient. Then if the linen, the patient's bed is soiled, we're supposed to clean the beds, remove the dirty linen and put clean linen so that the patient is left comfortable and dry and comfortable. So all this is done to promote the patient image and hygiene. So in our evaluation is that the patient has been assisted with the activities of daily living. So these were the 5 problems that we identified for a patient with a severe malaria. So complications of severe malaria as follows: cerebral malaria, anemia, splenomegaly, because of excessive breaking down of red blood cells, and jaundice due to excessive breakdown of red blood cells, which will cause accumulation of bilirubin in the blood. Then there's also kidney failure due to the renal involvement, which can be evidenced by a patient having black water fever, and so forth. Then how can we prevent malaria? We want to treat all uncomplicated malaria cases. We have to treat them. Then we can do these other things. So here is this is where we end with today's presentation or revision. So if you're a student, make sure you go through nicely, you pause the video, you download the video, go through it nicely so that you understand it properly. In case it comes into the exams, and in case you have a patient that you need to miss with severe malaria, you can have this tool to help you go about it. Thank you so much for listening and watching. Please like and comment. If there is any topic that you would like us to revise, please write in the comment section. Thank you so much. Do have a blessed day. Bye.